Welcome to My Black Health is Beautiful. Diane and I are super excited to be here and talk about the lesson plan series today, and looking forward to your questions and interest in learning more about the lesson plan series.
Yeah, I see the numbers are going up, Tara.
Yay! Wow. I feel like I'm smiling. I'm excited. I feel like the girl on the cover.
Okay. Yeah.
It's such a happy image.
It absolutely is. And it just highlights the title of the lesson plan series. It really does.
Doesn't it? It always feels like to me like she's like sitting in the sun, smiling.
Absolutely.
Yeah. It's really awesome.
Yeah, folks are liking it too. That's great.
Oh, that's so cool.
Yeah.
That's so cool. Thanks for joining, everyone. Welcome. We're excited to talk more about the lesson plan series and all the different resources that it offers. And if you're just joining, Diane and I were reflecting on, how much happiness and joy that the image on the cover reflects.
Absolutely, absolutely beautiful.
So I'm actually going to stop sharing my screen, so you'll be viewing just Diane and I, but what we want to drop in the chat is the link to access the free lesson plan series. So for you and your friends, family, colleagues to access, but if you visit myblackhealthisbeautiful.com, you'll be directed to a webpage where you could click the downloadable link and access the full lesson plan series, and you could follow along with us throughout this conversation. We're so excited to be here with everyone today.
Well, it might be nice if you tell them who you are, Tara.
Yeah, so really awesome. So thank you for dropping that link in the chat. So encourage folks to download the lesson plan series. So I'm excited to introduce myself. My name is Tara Norman. I use she, her pronouns, and I have the pleasure of serving as the Director of Diversity, Inclusion, and Health Equity for Planned Parenthood of Northern, Central, and Southern New Jersey. I'm really excited to be here with you all and to discuss the My Black Health is Beautiful lesson plan series, which was a collaborative project between Planned Parenthood, Southern New Jersey Perinatal Cooperative, Salvation and Social Justice, and Melanated Moms. And now I have the pleasure of turning it over to my colleague, Diane Brown.
Hi, everyone. So excited to be here. My name is Diane Brown. My pronouns are she and her, hers. I'm retired. I'm a retired educator, trainer, and administrator of human sexuality education programs. I continually consult with people on various issues. And I'm also excited to be here because I'm one of the co-authors of the curriculum. So back to Tara.
Thank you so much, Diane. So there's just so much for us to get into around this lesson plan series. And I think for our audience and for ourselves, one of the most helpful places to start would be just talking a little bit about the current landscape of maternal health and why resources like My Black Health is Beautiful are an important education tool to improve health outcomes. Can you tell us a little bit about that, Diane?
Absolutely. So My Black Health is Beautiful was something that came together because we saw the need. And in New Jersey, we absolutely knew that the infant and maternal mortality rates were very high. But when we talk about the actual title, or we look at how we look at the landscape, back in 1960, Black is Beautiful was coined as a phrase. However, it was not realized because it still held some of the favoring of light skin over dark skin. So when we talk about My Black Health is Beautiful, we're talking about the entire spectrum, and this is my shirt, to be able to look at the fact that all Black health is beautiful. And there's more in terms of your health being an important aspect of how you are beautiful that we're really going to highlight and talk a little bit about in this curriculum. From whether you can advocate for yourself, whether you understand what your body looks like, whether you understand that it's more a holistic approach to who you are, and knowing something about your family history. All of those are aspects of why my Black health is beautiful and how the landscape is changing now as we look at the importance of your Black health being beautiful.
Thank you so much for lifting that up. And so we talked a little bit about this in the intro and talking about the beautiful image that's on the cover. But can you tell us a little bit more about the name of the lesson plan series and what impact does the representation in the title, My Black Health is Beautiful, have on the Black community specifically?
So we do know that there are aspects of Black health that are highlighted, and sometimes they're the negative aspects of Black health, as they talk about the number of us that are impacted by illnesses like diabetes, HIV, and they even coined obesity as a part of that. So all of these things are very negative. However, it's important to talk about the beauty or the positive aspects of our health. The fact that we have survived, we have endured, and we continue to be more healthy as we move forward. The fact that we are still struggling with infant and maternal mortality is a big issue. The fact that this is not something that just happened, we've got years, historical aspects going back from when hospitals were first put into place, and that removed some of the midwives and doulas and people who used to take care of us and look after us in terms of our health, especially among those of us who identify as the ability to birth children. A lot of that changed, and the treatment that we were provided changed. So as we look about this lesson plan series, we want to emphasize that we are beautiful people, and our health is an important aspect of who and what we are, and how we pass that on to future generations is also very significant.
Thank you so much for raising that, Diane. So one of the first questions that I want to ask you directly related to the content in the lesson plan series, right? So there's just so many things that this curriculum covers, including holistic reproductive health, anatomy and physiology, intergenerational health, and self-advocacy. But I really want to start with the lesson plan on anatomy and physiology. Why is it so important for Black and Brown communities to see themselves reflected in medical illustrations? And what impact does this have on people's experiences within sex education? And while you're answering that, I'm going to pull up one of the images in the background and share my screen, but I encourage folks to check it out in the full lesson plan series, because there's just so much that these medical illustrations cover.
So it's historically, we've looked at television, movies, books. We've even looked at love scenes, and they were always not with people of color. So these images in our lesson plan validate the fact that our bodies are beautiful, and this is what they look like. And so when we're looking at something like, especially when kids, young people, look at things and they see themselves, oh, that skin tone looks like mine, more so than an image of a white skin tone. There's more relationship with who and what I am and how I look and what the importance is of why I look this way. It can also be conceptualized that when you see something that looks like yourself, you're more likely to take it seriously than it would be if it looked like somebody that doesn't look like you. It also provides a level of confidence in how we see ourselves. This is absolutely beautiful. And if you take a mirror, those of you that have genitals that look like this, and take a mirror and look, you can see all of these parts in who and what you are. So there's some importance in being able to look at this so that it looks like you, and that all of these parts are named, and you can look at this picture and look at yourself if you are a person who shows up with these genitals and see all of these parts. Something that you may not have done if this was a white image, because like that doesn't exactly look like me. It's also important to continue to identify images that look like us, whether it's from our hair to our skin tone to the shape of our bodies. It is very validating to see that in some place other than just a mirror. It builds a level of confidence that this is what I look like, and somebody else recognized what I look like in this publication. So all of those things are really important in terms of how we see ourselves and how we are understanding the health that we can have, even sexual health. Because quite often when we think about sexual health, we don't necessarily think about the body. A lot of people think about the acts that are sexual, but sexuality is much broader than just the act of having or engaging in sexual behavior. It's your understanding of your relationships with other people. It's how you see yourself, your body image. It's also how you learn and understand yourself as a sexual being, how you identify based on your gender or based on how you relate to other people. So sexuality is much broader than just the body parts. But to see those body parts like you might see them in a mirror, well, for people who are not Black or brown, to be able to see that those body parts are the same body parts, they're just a different color, is amazing for people to see that, to be exposed to that.
Thank you for sharing that, Diane. You know, one story that was so striking to me, one of our educators at Planned Parenthood was actually using the curriculum to teach a sexual health education lesson. And when she showed one of the students the images from this curriculum, her reaction was, she was in such a state of shock. She said, wow, I didn't know it was okay for my vagina to be dark. I went my whole life thinking that my vagina was too dark. And we come to understand now that so much of that is because she hadn't seen images that validated that this is what your body is supposed to look like. And so she, you know, it was almost disheartening because she was actually using bleaching creams and home remedies because she thought that she had to lighten the tone of her vagina. And so it's amazing that resources like this are able to affirm, not even just young people, you know, people of all ages, that this is what your body is supposed to look like.
That's absolutely true. And that's also absolutely true for people who have penises. Penises come in different shades as well. Some are dark, some are brown, some are very light. So when people look at these different images, it's important to realize that there is variety and that it's okay to have that variety.
I really appreciate, someone in the chat said, I appreciate the inclusion of pubic hair in the images, right? And like, you know, how important is that, you know, to normalize that, you know, all different bodies, you know, have, you know, different textures and tones and shades of hair, and, you know, like really beginning the conversations toward reducing the stigma around, you know, what your anatomy is supposed to look like.
Absolutely. And there's no supposed to look like, they look different. You really can't see it in the images because we're limited in terms of this being a curriculum. But if you were to see images of people's nipples, those are also different shades, different shapes. The width and the dynamics of those are also very different. So it's amazing and fascinating to be able to see these differences among people, but essentially the functions of those body parts are the same for everybody.
Oh my gosh, I love what you said. There is no supposed to look like. Thank you for uplifting that because it feels so important to this conversation, but really the broader conversation of our health. So I also want to ask of you because there's just so much great content throughout this entire lesson plan. But one of the tools that feels particularly important to the conversation around improving health outcomes is the lesson plan on self-advocacy. So in the advocacy world, Black communities are often mislabeled as voiceless, right? So tell us more about how the lesson plan on self-advocacy is a resource to combat this stigma.
So when we talk about voiceless, we mean that people aren't being heard, that people have no influence on change, that there might be bias that limits a person's ability to share their thoughts and views. And it is absolutely something that may be a way to turn somebody off. So the Black community is not voiceless. That has been proven over and over and over again, whether we talk about marches, whether we talk about volunteerism, where we give back to the community, where we provide food and clothing, where we support people and offer free services. And even those middle class or upper class people of color who pay for those services, the Black community is not voiceless. There have been a number of opportunities in those events for people to advocate for themselves. However, that is not always highlighted. Quite often, we have been giving back to people, but we have not taken the opportunity to share how you do this for yourself. So we talked a lot about people going for care, and let's just use maternal health as an example. Women are encouraged to get their pap smears and encouraged to have their breast checked on a regular basis. All of these things people are encouraged to do. However, where is it that people learn to do this because it's important for their health, because it's important to them? So this curriculum points out ways in which those conversations can take place. Conversations are so vitally important in terms of self-advocacy and having that agency to know when you need to do something and speak up for yourself, or when you need to say something. And we have now more examples of that, even though these people are famous. For example, when we look at like Beyonce, when she went through her challenges, or we look at, okay, and I'm blanking, Tara, help me, the tennis
Serena
player.
Williams.
Okay, Serena Williams, yes.
Yeah.
When Serena spoke up for herself, these are examples. And just because these people have money, that doesn't change the fact that you who may not have a lot of money or are not famous can't have those same skills and ability. And that's what this curriculum offers. It offers an opportunity for you to practice some of those skills and look at how you speak up, where you speak up, how you go about deciding this is the time to do that. It gives you some exercise to look at where you are now and where you might want to be in terms of that ability to advocate for yourself. And sometimes it takes courage. And by participating in some of these lessons, that can give people the courage to do that. It's not always an easy thing to do to speak up to a physician. People have long believed that this is the authority figure and this person, quote unquote, knows better. However, who knows one's body better than oneself? And if you know your body, you know that that's not right, that something's not right, that's the time to speak up. Or maybe something is right, but you want to know how to make it better. That's the time to speak up, ask the questions. Yeah, Google's available. You can definitely Google and get an answer, but it's very different when you're talking to another person. And so it is important to look at this curriculum and how you move forward. with advocating for yourself.
Thank you so much for sharing that piece on self-advocacy. And one of my favorite lesson plans within the series that I really want to get into is the lesson plan on intergenerational health. So can you just tell us a little bit, why is it important to have conversations about familial health history within Black and Brown communities specifically?
So it's really important to be able to talk about your health. And I always give an example of a family I know, and the reason why this is important. So there's a grandmother, a mother, and a daughter. The grandmother had a miscarriage with her first pregnancy. The mother had a miscarriage with her first pregnancy. The daughter had a miscarriage with her first pregnancy. If there had been conversation between the grandmother and the mother, they would have realized that something happened, and they would have been able to talk about what could have been done around their miscarriage or around their first pregnancy to avoid that. Then having a conversation between the mother and the daughter may have prevented that third generation having a miscarriage. So conversation about your health between family members is absolutely crucial in terms of the next generation. So I always talk about having a conversation about health, whether it's around medical issues, whether it's around things that are possible for the future, whether it's health issues like illnesses that you have in your family. Conversations about intergenerational health are absolutely crucial.
Thank you for sharing that. So Diane and I are actually going to demo a quick activity that's in the lesson plan on intergenerational health. And you can follow along on page 29 if you have it in front of you. Are you ready, Diane?
I'm ready.
All right, I'm ready.
Okay, Tara. Okay, so Tara, do you know your grandparents?
Yes.
Okay, that's exciting. Do you know where they were born?
I do not. Generally, yes, but specific hospital and city, no. But I know they were born in the South.
Okay. So if you know they were born in the South, but you don't know exactly where, did you ever hear any stories about your mother's birth or your father's birth?
I never heard stories about my mother or my father's birth. No, and I actually never thought about it until this activity.
Okay, all right. So did somebody tell you about your birth story?
I do know the story about my birth. My mom's water actually broke in the shower. So she didn't know that she was in labor, and she went to work, and like halfway through the day, she had like excruciating contractions, and then she drove herself to the hospital.
She drove herself to the hospital. Okay, and then when you were born, was there anything about how you came out?
Yes, I actually had a really high fever and had to be isolated for a few days.
Okay, okay. Do you know if that caused anything different moving forward with you as a young child? Like, did it cause any kind of illnesses or anything?
I actually don't know.
Okay, okay, all right. Do you know if you were breastfed?
So my mom says that she tried. It didn't last very long. She told me that she got a duct infection.
Okay.
So then she became like fearful of getting me sick, and it also became very painful for her. And because I wasn't able to eat, like I started taking formula.
Okay, all right. That's great. That's great that you know, that you have some sense of what happened when you were young. Now let me ask you another one. Do you know what age your mom got her period, her first period?
I actually don't. I don't. So I've heard like so many different stories about like my mom and her sisters. So my aunts like getting their period all around the same time because they were pretty close in age, but I actually don't remember specifically how old they were.
Okay, so those are important things to know, not only for future generations, but you have a sense of how your family history in terms of health moved forward. Absolutely. Thank you for
Thank
sharing that
you.
and telling me about the conversations that you had as a young person with your family.
Yeah, and you know what I love about these questions is that they create space to have more detailed discussion around family health. So like for someone who might be nervous about having these conversations with their parents or their family, these questions are a really, really good starting point.
Absolutely. They definitely are.
So my last and final question to you is, why is Black health beautiful to you?
So Black health is beautiful because we want to live and experience as much life as we possibly can. We also want to be able to have a healthy experience during that lifespan. So it's very important because one, I'm Black, two, I'm beautiful, and I'm going to take care of my health.
I love
So what
that.
about you, Tara? Why is Black health beautiful to you?
So why is Black health beautiful to me? Oh my gosh, I have so many answers. I mean, I think Black people are beautiful. I think Black culture is beautiful. I think Black families and Black communities are beautiful. And most importantly, I think that all of that beauty should be reflected in our healthcare and more importantly, in our health outcomes. So yeah, and I really want to turn that question over to the audience, right? Like drop in the chat, please. Why is Black health beautiful to you? No matter how you identify, why is Black health beautiful to you? So excited to see some answers come in, and we're now opening up for the Q&A session. So please drop your questions in the Zoom Q&A feature or in the chat. And we're excited to give you all some feedback. Black health is so diverse.
Right? Yeah.
Seeing some answers come in the chat and want to shout those out.
Yes.
Why is Black health beautiful to you? And feel free to drop in your questions along with that. And there's no wrong answer to why Black health is beautiful to you, because there is beauty in our diversity. I love that. I love that. We have the right to be. Black health is powerful and motivational.
Yeah.
Oh, awesome. My Black health is beautiful because it serves purpose and meaning to the next generation. Thank you, Jonte. This is so awesome. My Black.
Okay, yes, this is nice. Haley. Yes.
Yeah, do you want to shout out Haley, Dr. Brown?
Absolutely, Haley. I just loved it. Because it's more than absence of illness, it's thriving and wellness and health is a human right. Absolutely. Yes, yes, yes.
I love that one. I love that one. Brittany says Black health is beautiful because everyone has an experience to share. We learn so much from others' lived experience. That is so
true. So true. So true. Let me go back up and see if there's others. Okay, so we have one that says, my Black neighbors, friends, colleagues inspire me and make my world better. Of course, Black health is beautiful to me. It's inclusive. Black health is generational health.
Marie says Black health is beautiful because it is who I am. Our roots tell our history and we get to live it out. That is so true.
Yes. Yes.
Our history. How about that one? Wow.
Absolutely. Roots tell our history. Absolutely. And that's why it's important to know your family, because that can go back several generations and you have an understanding of how health was back then and how health is now, and how you can advocate to have a more holistic approach to your health and how you care for yourself and those you care about.
We have a really good one from Luna in the chat. Oh, there's so many good ones coming in. Luna says, Black health is beautiful because we matter.
Okay. My 5-year-old daughter said it's beautiful and it's Black. All right now. All right.
I love that. I love that. And I just love how amazing it is to hear these affirmations from young people, like who, you know, fortunately, you know, haven't had the experiences of systemic harm in so many ways and are just so affirmed in the beauty of their health and who they are. So amazing. Thank you for sharing that from your daughter.
My Black health is beautiful because Black health does matter. All right, Sabrina, I hear you.
Well, we're just so thankful for this feedback from all of you, and more importantly for this space to share today, and to continue these conversations around the beauty of Black health and improving maternal health outcomes. So thank you all. Diane, anything that you want to share to close us out?
I just hope you all take a look at the curriculum, and if at all possible, use it, and don't hesitate to reach out to Tara if you have questions. We'd be more than willing to answer and help and support.
Yeah, I'm going to drop my info in the chat for folks. And feel free to reach out. You know, we're more than happy to continue having these conversations in other spaces. But thank you so much for allowing us to be here today. Thanks, everyone.
Thank you.
Yes.